Good afternoon, and welcome to today's webinar. My name is Jackie Halliday, and I am the Communications and Outreach Assistant here at the Brain Injury Alliance of New Jersey. Today's webinar is on maneuvering through the Social Security Disability Application and Appeal process. Participants will learn a short description of Social Security Disability income versus supplemental security income, preparing to apply, what documentation is needed, specifically for brain injury, submitting your application, and navigating the appeal process. This presentation was developed with support from the Partners for Health Foundation. The Partners for Health Foundation is committed to creating healthier communities by supporting and advancing good health, wellness education, and disease prevention and treatment. Throughout the webinar, feel free to write your questions in the Q&A pod, which can be found on the right side of your screen, and at the conclusion of the presentation, we will address as many questions as possible. In case you're not familiar with the Brain Injury Alliance of New Jersey, I would like to give you a little background on who we are. The Brain Injury Alliance of New Jersey is a statewide nonprofit dedicated to improving quality of life after brain injury. Since being founded by a small group of concerned parents of children who had sustained brain injury in 1981, we've grown to become the primary source of information, education, and advocacy, support, and hope for people with brain injury and their families in New Jersey. Today, our dedicated staff, board, volunteers, donors, and community partners proudly serve over 10,000 New Jerseyans each year. BIANJ has webinars on various topics throughout the year. If you've missed some of our past webinars, feel free to look at what we have on our website at bianj.com/webinars, as you see outlined on your screen. If there is a topic you'd like to learn more about and don't see it on our site, let us know. We are always open to suggestions and recommendations of speakers and presenters. Also, never miss a webinar again by signing up for our e-news on our site. We are honored to have Janine Holloman with us today to present this webinar. Ms. Holloman has been a vocational rehabilitation counselor for close to 40 years in both the public and private sector. She graduated with a master's degree in vocational rehabilitation counseling from Michigan State University. She is also a certified rehabilitation counselor, a licensed professional counselor, a certified brain injury specialist, and a Social Security disability representative. Janine is the past president of the International Association of Rehabilitation Professionals and still serves on the state chapter board. She's a member of the Brain Injury Association of America and the National Association of Disability and Representatives. So, with no further ado, Janine Holloman.
Thank you so much, Jackie, and thank you for asking me to do this presentation. Would like to start out by saying that the disability determination process is extremely complicated, confusing, and at very best, pretty difficult to maneuver around. And we only have less than an hour because I want to make sure there's plenty of time for questions and answers. So this is by far and away not going to go into any huge detail, but is just going to give you some of the overviews. And there's a couple places in here where I can interject in terms of if you would like a follow-up presentation on certain aspects that we're just not going to have time to cover today. One of the associations I'm a member of, the National Association of Disability Representatives, have people who, both attorneys and non-attorney representatives, who have been representing people for 30, 40 years. We are still on the TalkNet regularly asking questions. Those folks are asking questions because there's just, for every rule, there's an exception. For every exception, there's another exception, and then you have all the other issues that come cropping up with your individual claimants. So this is an overview, and I'll try to keep it as clear as I can. Be sure to ask questions. And again, if you would like follow-up presentations, I'd be happy to help out with that. So let's get going. Under the Social Security Disability System, there are actually two programs, SSDI and SSI. And when I'm talking with a person for the first time, I'll say, which one have you applied for? Well, I'm on SSD. I'm on Social Security Disability. And I'll ask them, is it SSDI or SSI? And they'll say, I don't know, I'm on SSD. There are actually two programs under the Social Security Disability Program with some very, very important distinctions. So I wanted to start with that because there's some ramifications all the way down the line depending on which program you are eligible for. Both Social Security Disability Income Benefits, SSDI, also called Title II. If you get on the Social Security website, you'll see Title II and Title 16. SSDI is Title II, and Supplemental Security Income, SSI, is Title 16. They are both part of the Social Security Disability Administration and the benefit program. However, there are both similarities and some very significant differences in the two programs. Okay, what both programs do have in common. Both programs have the same medical eligibility requirements. Both programs are adjudicated and you go through determination exactly the same way. And both programs do offer both monthly income and health benefits if you are found eligible. So when I'm doing a Social Security disability case and getting it ready for either an initial application or a hearing, I do it the same way. There's absolutely no difference in what I'm looking for and how I work a case. Okay. Now, let's look at Social Security Disability Income, SSDI, first. That program is classified as an insurance program. If you are currently working or if you have worked, you have paid into this program through your payroll taxes. Monthly benefits are based on your pre-injury earnings. You can get as little as $400 a month on SSDI if you win your case, or you can get upwards to $2,000 a month on your case. It all depends on how much you've paid in. So if you've worked pretty steadily and at age 50 you're applying for SSDI, you'll obviously get more than somebody in their 30s who might have only worked sporadically. So there's no set earning limit on the monthly benefits. You also, and this is very important, you also have no earning tests, including no family earning limit and no limit on unearned income. What that means is if you're awarded SSDI benefits, if you've been found eligible for SSDI based on the fact that you've been working up to your injury, you can have $1 million in the bank. You can be married to a spouse who has $1 million in the bank, or your spouse can make hundreds of thousands of dollars a year, and you can have money in the bank. You can have annuities, you can have retirement plans, you can get an inheritance, and it doesn't matter. If you are found eligible for SSDI, you will get your monthly benefits, and what else is going on in your family financially doesn't matter whatsoever because it's an insurance program. Medicare, you are Medicare eligible after 2 years from the date of disability. I do not know why there's a 2-year waiting period for Medicare. Every claimant who wins their case thinks they're going to get their Medicare immediately, and I have to remind them. Now, it's not 2 days, or it's not 2 years from the date of the hearing. It's 2 days from the date of disability. So since for a lot of claimants, the adjudication process can take about 2 years, usually their health benefits are going to start in pretty soon after the hearing. But if you win it on initial application, which means about 6 months from the time you applied, your Medicare is not going to start until 2 years from your date of disability, but you will get Medicare. All righty, now comes SSI, Supplemental Security Income. Here's the big difference. SSI is classified as a welfare program. Monthly benefits are capped at the poverty level, currently $733 a month for an eligible individual and $1,100 for an individual with an eligible spouse. So what that means is if you're awarded SSI, you're going to get a check for $733. that can be raised based on the cost of living, and that 733 is just the newest. There was an increase as of January 1. Claimants who are SSI eligible are Medicaid eligible from the date that they file. Now, that's a big difference between SSI and SSDI. If you're SSI eligible, you win your case, you get it. There's no 2-year waiting program. Don't know why. These are legislated programs. Talk to your congressman. Also, this is the other big thing. There is a significant earning testing with SSI. You have a $2,000 cap on all total assets. Now, that does not include your house or your car. You can, well, unless you have a Cadillac, but if you have a reasonable car and you own a home, you're fine there. But you cannot have any more than $2,000 in the bank. There are earning limits on the household income and your spouse, and again, this is something we don't have time to get into today, but there's household limits on earnings, and some of it depends on how many children you have. If you get an inheritance, you'll lose your SSI. If you cannot have annuities, you can't have 401ks, you can't have any assets. For SSDI, it's only earned assets that they're worried about. All of your unearned assets, your savings, annuities, things like that are fine. Under SSI, it's any earnings will go against your SSI. And I'll give you the perfect example. I had a lady who had severe pulmonary problems, and she eventually was diagnosed with lung cancer. She met all of the medical requirements for getting SSI. But her husband, who was retired, had good retirement plan from his employer. He was a union person. Also had 401ks and private retirement benefits, and they had an income property. He had an income property on an apartment that he owned or a house that he was renting. So she was disallowed from SSI even though she was severely medically disabled because she didn't meet the income requirements. So that's the problem with SSI. All righty. How does Social Security determine which program a claimant is eligible for? To qualify for SSDI, a person has to have worked 20 of the last 40 quarters or 5 of the last 10 years, and that can be non-consecutively. So I have a lot of women who are kind of in and out of the job force for a while their kids are little. That's okay. They can still qualify for SSDI as long as in the last 40 quarters up to their disability, they worked 20 of those last 40 quarters. Now, here's another one of those exceptions to the rule. For applicants age 30 and under, you don't have to have 20 quarters. It starts out with 6 quarters, a year and a half of quarters if you're age 18 to, I believe, 20 or 24, and then it slowly goes up until age 30. So if you're a younger worker and you've been working maybe since age 16, you get injured at 18 or 19, you are eligible for SSDI because you don't have to have 20 quarters. You don't have to work for 10 years. SSI applicants are children, adults who have never worked, or adults who have worked but do not meet the 20/40 rule. Now, let's talk about that for a second. I had a young man who at age 19 was in a car accident, and he was awarded SSI benefits. He had just not worked. He was just out of high school and hadn't really worked, so he was on SSI. He went to work at a supported employment program, Goodwill Industries, had a paycheck, but wasn't a big paycheck, but he had a paycheck. When he first got onto SSI, his mother wanted to set up an account for him to help pay expenses as he got older, kind of help him out when they weren't going to be around, and I told her obviously she couldn't do it. He was on SSI. He can only have $2,000 in the bank. As he worked at Goodwill, and again, when you are under age 30, you do not need as many credits to become SSDI eligible. He's got his injury, he's got his SSI, but he's working in supported employment. Suddenly, the family gets a letter from Social Security that says he is now eligible. He has enough work credits that they were flipping him over to the SSDI program. Suddenly now, all those income requirements are gone. He can now have a condo. They can put money away for repairs to the inside of the condo because now under SSDI, all of those earning limits are not a problem. So you can start out on SSI, work, and get onto SSDI. One rule about children. Children normally who qualify for Social Security are SSI eligible. However, and here's another one of those exceptions, if you are a disabled child of a disabled parent, you go on to SSDI based on your disabled parent's earning record. So instead of getting the SSI, the 733, as a disabled child, the child could easily be getting a lot more depending on the parent's earning level, but it has to be a disabled child of a disabled adult who's receiving SSDI. You can earn it on your parent's credit. So again, it's another one of those exceptions to the rule. Also an exception to the rule is the fact an adult can receive both SSI and SSDI benefits if he or she has worked enough quarters to be SSDI eligible, but the monthly benefit rates on SSDI alone fall below the 733. I know folks are now probably starting to get a titch confused. 733 is the new poverty rate for this year. So if you have worked enough credits to be awarded SSDI, but let's say your benefit rate, because maybe you didn't work a lot or you were working minimum wage jobs, was, say, for example, $500 a month, you are still below the poverty level. So Social Security would pay you the additional. You would get your $500 in SSDI, and then you would get $233 in SSI benefits. You'd get one check, but part of that would come from the SSDI program and part of it from the SSI program. The only difference with that is, or the only thing you have to keep in mind, is that if those income status issues change, let's say you're single, you're getting the combination, and you marry a high wage earner, you would lose the SSI portion of your benefits, but you wouldn't lose the SSDI portion of your benefits, because remember, there's no income means testing under SSDI. So I'm seeing some questions pop up, and I don't know when. Do we want to save them for the end, Jackie?
Yeah, we usually save them for the end.
Okay. All right, so let's look at the 5-step sequential process. This is kind of the Bible of how somebody is awarded either SSI or SSDI. It's a 5-step. Interestingly enough, step 1 has nothing to do with disability. It has all to do with earnings. All right, so under your step 1, are you currently working, or have you worked in the last 6 months at SGA, substantial gainful activity, $10,090 a month right now, or $1,820 if you're blind? All right, so let's back up here a little bit. If you went out tomorrow, if you've been working right up to today, and tomorrow you go out and have a car accident and you are too disabled to work, your date of disability would be tomorrow, the 15th of January. For SSDI, you have to be off work for 6 months before you are eligible for benefits. You can apply before that 6 months is up, but your benefits will not. There's a 6-month waiting program for SSDI. Again, I don't know why. Legislated again by the folks in Washington. If you are SSI, you are immediately eligible for SSI at the date you either stopped working, or if you've never worked, the date you filed. Again, no waiting period for SSI. a 6-month waiting period for SSDI. So I get a call, I get a lot of calls from people like beauticians. And for folks who don't know, being a beautician is really physically demanding work. You ruin your shoulders, your rotator cuff, your back, sciatic nerve. Is just, it's a lot more physically demanding than what you think. And these beauticians are all making about $3,000, $4,000 a month. And I'll say, well, how much are you bringing in right now? And they'll tell me. I said, well, you have to be eligible. Can you cut your earnings down to $1,090 a month? Well, no, I can't. I'll starve. Well, then you're not eligible. But I have all these problems. Yes, I know. You can have all of the medical problems in the world, but if you're currently working and earning above $1,090 a month as of January 1st of this year, you're not eligible. You can be working part-time under that 1090, but you cannot be currently working over 1090 a month and be eligible for benefits. And for SSI, obviously not working at all. Step 2, do you have a disability? Finally, they're going to ask you the disability question that prevents you from working at SGA, the 1090 a month, that will last for at least a year or result in your death. They do not want to pay benefits to people who are going to get better as soon as they have a surgery, or who may have had an accident, but it looks like they may have a full recovery. Now, again, one of the exceptions to that is applying for a closed period of disability. We don't have, obviously, time for that today, but under some circumstances, there are some people that are eligible for a short period of disability. It's called a closed period, and I've worked some of those cases before. Step 3, do you meet a listed impairment? A little later down, you're going to see the website for the Federal Social Security program. It's www.ssa.gov. It's going to be in a slide farther down. If you go to the website, and it's a pretty good website to maneuver around, and you go up to the search engine and you type in listing of impairments, it'll take you right to the listing of impairments. Again, we don't have time to go through all the listings today. That's a whole session in and of itself. And those listings change from time to time. But this is the worst case scenario for all of the major disease processes. And I tell folks, if you meet a listing, you automatically win your case. But boy, you don't want to meet a listing if you can help it, because these are serious injuries and illnesses. But if you meet a listing at step 3, you automatically win your case. The listings change from time to time. They're working on the listings again right now. Perfect example is HIV and AIDS. That used to be considered in the listings a terminal illness, and folks automatically got either SSI or SSDI for being HIV positive, not necessarily full-blown AIDS. They've now moved that to a chronic illness, and it's not, you have to meet all the other qualifications now. It's not an automatic for AIDS or HIV. So those listings change periodically depending on what's going on in medical science and research and things like that. Now, this step 1, step 2, and step 3 are exactly the same whether you are a child or an adult. There is a child listing of impairments, but it's pretty close to the adult listing. There's very few differences between the childhood listings and the adult listings. If as a child you don't meet a listing, there's a whole nother process beyond the step 4 and step 5. Again, we don't have time for that today. If we've got a little time at the end, I'll try to get to that, but that might be another session on looking at the childhood impairments and the disability determination process for children. So from here on in, we're talking only about adults in the step 5 process. All righty, step 4, does your disability keep you from doing any of the jobs you performed for the last 15 years prior to your disability? Or if you're young, when you started working, from the time you started working. If you haven't worked for 15 years, it's from the time you started working. Before 15 years, if you've worked, if a job you've had beyond 15 years, Social Security says, that job is probably dated and you probably no longer have the skills for it. If the answer is yes, you don't get disability. So for example, if you were a construction worker at the time of your injury, but before you became a construction worker, you were a data entry clerk at another employer and you can still do sit-down work, then you would lose your Step 4 argument and they would deny your case. If the answer to Step 4 is yes, you have the disability that keeps you from doing any of the jobs you performed for the last 15 years, it doesn't necessarily mean you win, but it means you go on to Step 5. And here for people under 50 years old is the biggest issue of why you get denied so often when you're under age 50. That Step 5 means, does your disability keep you from doing any job in the general labor market within your skill level and physical restrictions? The employers don't even have to be hiring. The jobs just have to exist in the labor market. So you're talking ticket taker at the movie theater. You are talking like a simple assembly person if those jobs actually exist anymore. Visual security guard, telemarketer, any of those jobs you don't need any skills to do. So under age 50, this is your Step 5 sequential determination policy. Okay. Now, if you're over 50, you get a break. Social Security, as I tell my claimants, is one of the few programs where the older you are, the better off it is for you. Claimants 50 and older have a different set of criteria called the grid rules that negate the Step 5 argument. You don't have to go down to that Step 5 argument for any jobs in the common labor market. Social Security assumes that if a claimant is over 50, they're not likely to be retrainable and that employers are more likely to pass them over for younger applicants. So so when I'm talking to somebody and deciding whether or not I'm going to take the case, if they're over 50 years old, I immediately go to the grid rules and look and see if we can get them automatically approved based on these rules. So the older you are over 50, the more likely it is you're going to be approved for benefits. And if you're over 50, you don't have a high school diploma. Better yet, if you get into your 60s, I'd never want to say slam dunk when it calls to a Social Security application, especially in this day and age. But if you are like 60, 62 and you've got some decent medical documentation, it's very likely you're going to get accepted at the initial application and not have to go to a hearing. One little caveat, if you are awarded SSDI, no matter what your age, and you continue that on, you would then eventually flip over to Social Security retirement at the time you are at full retirement age, whatever that is for you. It's different now for everybody. For my age group, it's 66. For some folks, it's 65. I know for younger folks now, it's like 67, 68. But you stay on Social Security disability, but then you do the automatic flip to Social Security retirement when you reach full retirement age. Okay, the initial application process can be done three ways. It can be done online, and that's what Social Security prefers. It can be done by a phone interview by appointment, and it can be in person at your closest SSA field office, also by appointment. They prefer online. At one point, Congress was trying to make a change that they completely get rid of any in-person and telephone services. Several organizations, including Social Security, and organizations such as mine, were vehemently opposed to that because we have folks that are not computer literate, they have no access to computers, they're functionally illiterate, or brain injury is so severe that they cannot maneuver through a pretty cumbersome web page, and that got shot down fairly quickly. But I wouldn't be surprised to see that come up again as Social Security and Congress tends to look at more ongoing budget cuts. So if you go online in a minute, we're going to show you how to do that. Phone interview, you call the Social Security number in your phone book and set up a phone interview, or you call your SSA field office to set up an interview. All right. How to prepare for the initial application. There's that website, www.ssa.gov. It's actually, as I said, a pretty good website given the fact it was developed by a bunch of government bureaucrats, and fairly easy to access. When you click on the drop-down menu, you will see apply for you'll see disability. You'll click on that, and you'll say apply for disability. You'll click on that, and it'll bring you to the first thing that you can download, and I would definitely say do this. You need to download and print the disability starter kit and the adult disability checklist. Those are little forms, that's a little, those are forms that help you get ready to either do your online application or to be ready for the phone interview. If you don't have access to a computer, when you set your appointment for a phone or in-person interview, ask that these forms be mailed to you. You frankly don't have to ask, but just in case somebody forgets, be sure to ask for them, because those phone interviewers don't want to spend 3 hours on the phone with you while you're looking up doctors' names, addresses, and phone numbers. This disability starter kit and the adult disability checklist help you get all of your ducks in a row so that no matter how you do this, it's a pretty smooth process. All right, what you need to do and what the disability checklist will help you with is you need to have the names, addresses, phone numbers, as well as first, last, and next visits for all doctors, physical therapists, counselors, clinics, hospitals, anyone else who's provided any services to you. Also, you have to have a list ready of all your medical tests completed, CT scans, MRIs, x-rays, and where those tests were completed and approximately when they were completed. Especially for TBI survivors, judges live and die by neurological reports. There's been a neurological assessment. Boy, make sure you've got the dates and who did that and how, and again, name, address, and phone numbers of the provider for those neuropsychs. Judges look at those very carefully when they're determining eligible benefits for TBI folks. So this is where you do your homework. This is where you get out the phone book, you look at your day planner, do the best you can on the dates, because down the road, Social Security is going to be asking those providers for those documents. But if you're on the online system and you're trying to dig that stuff up at the time you're doing your online application, you can get logged out, and then that's not a good thing. And in a minute I'll explain why that's definitely not a good thing, because then you have to start the process all over again. You also have to list high schools, all the schools you attended, and any vocational trainings you have had. Here's where in the vocational you go back 15 years. Now, you don't have to list the names of specific employers, but you do have to list all the jobs that you've had in the last 15 years. If you've been a construction worker for the last 20 years, you're a construction worker. You only have to list one job. If you've had multiple jobs in those last 15 years, again, you don't need the specific name, addresses, and phone numbers of the employers, but you do need to have the job title, the hours that you worked, were you full-time, part-time, 8 hours a day, 5 days a week, or different, and what your job duties were. So again, you want to get that prepared ahead of time, both to help out the examiner in a phone interview or an in-person interview, or when you're doing your online. Have all your pre-application information with you. Either bring it with you to the interview or have it right there by the phone for your phone interview, or have it right there on the computer for your online. This is for the online. If possible, leave yourself enough time to complete all 3 sections of the online at one setting. Social Security says you should be able to get back into a partially saved application. That's this re-entry number. Always print or write down your re-entry number in case you have to leave the site or the site shuts down while you're working on it. Sometimes a lot of people get on that site and all of a sudden it's just gone. Never leave the site without hitting the save button on the page, on the last page you're able to finish. When you're working on your online application, at the bottom of each page you'll see save. Hit that save page before you go on. If you have to leave the site for some reason, or you do get logged off, this reentry number is supposed to get you back in. Remember, this is a federal program. I have had the experience, not so much the last few years, but in the past, I've used the reentry number, I've used the correct reentry number, and it says it's invalid and I can't get back in. So to save a lot of headaches, leave yourself, preferably the morning if you're better in the morning, or if you're better in the afternoon, leave it and do it so that you can do the entire application in one sitting so that you don't have to wind up going back and doing it all over again. All right, so your first part is pretty simple, and it's basic identifying information, your name, your address, your phone number. Are you a United States citizen? What's your Social Security number? Some very, very basic information. Now, somebody just told me that Part 2 and Part 3 have switched. I don't know. I haven't done an initial application in a bit, so excuse me, either Part 2 is going to be medical or Part 3 is going to be medical, but there's where you're going to put in all the names of those doctors. Oh, also have your medication list ready, because you're going to have to write in all of your medications, or put in all of your medications and who prescribed them and for what problem, what medical issue is this medication prescribed for. And then you'll do your job and activity form. Again, if you've only had one job in 15 years, that's going to be a real easy section for you to do. If you've only had one doctor, the medical section is going to be a pretty easy thing. But if you've had a traumatic injury and you've been to ER and you were in the hospital and then you were in aftercare and then you've been seeing specialists, that section's going to take you quite a while to do. But if you don't do it thoroughly and completely, it could mean your denial at the initial application level. And you don't want to go to a hearing if you don't have to. When completely finished, you'll follow directions to print the cover page and the medical authorization. That's a form that you will fill out and return that allows Social Security to get information for you on your behalf. They will contact every doctor, hospital, clinic, everybody that you've put down on that medical form, that medical section, to get records from them so you don't have to. But we're going to talk about that in a minute too. If applying by phone, the examiner will send that information to you, and if you're applying in person, you'll sign all those forms at the field office. All right, should I provide Social Security with my completed medical records? Well, here's the upside. At the initial application level, it's Social Security's responsibility to request your medical records from your providers. That means that you can't be charged, you personally can't be charged for getting those medical records. But if your providers don't respond in a reasonable amount of time, Social Security is going to rule on your case without it, usually resulting in a denial. I cannot tell you the people that did their initial application, they got denied. When I meet with them, and as their representative, I can actually get into their actual Social Security record. They'll say, well, where's Dr. So-and-so? Where's Dr. So-and-so? Where's my specialist? Social Security will usually give your treating physicians or treating facilities 3 times. They'll make 3 requests, and some offices only will make 2 requests. And if your Social Security, if they don't respond back, if you wind up in the bottom of some nurse's pile down in the medical records and they don't get it, they're going to rule without it. Now the downside, if you get those records, then you'll know you've got them and you can present them to Social Security or send them in or take them in, but your providers can charge you. So if you have a representative, or if you are working directly with Social Security in your initial application, you're going to want to keep real close contact with them to make sure that all those people that you listed on that initial application, that those records have come in. Because if Social Security is saying is, no, we still don't have from Dr. So-and-so, and no, we still don't have from Dr. So-and-so, you can then go get them and bring them into Social Security. But once they've made their decision, then that's it. They've made their decision, and hearings can take, depending on the jurisdiction, hearings can take anywhere from 6 months to 2 years, so you want to avoid going to the hearing. However, once you get to a hearing level, and that initial application has been denied, it is your job now. Social Security doesn't have to go after any medical anymore. They've done the initial application. It is now your responsibility in the appeal process to get any new information to Social Security or anything they didn't have when they first adjudicated your case. Okay, you've applied. Now what happens? Sometimes nothing. Social Security has enough information to rule on your application. You and someone you know may be asked to fill out a form confirming your daily activities and the impact your disability has on your daily life. You just want to be real honest on those forms. You don't want to embellish or lie. If the form asks if you can dress yourself and you can, say yes. Again, you don't want on those forms to make yourself out worse than you actually are, because you have to get in front of a judge. He's going to read that form and he's going to look at you and wonder, what you did on that form or what you were trying to prove on that form. Credibility is just so important all the way through this process, so you always want to be truthful and honest. You may be asked to attend a consultative examination by a Social Security doctor. You don't pay for that, Social Security pays for that. Failure to attend will result in a denial. If you don't attend, now there are reasons sometimes where you can't attend, you get sick, you don't have transportation, things happen, you need to reschedule it. But if you just blow it off and don't go, that's usually one of the ways you will get denied. A word about these consultative examinations. These are doctors that are hired by Social Security. They've never met you before, they'll never see you again. Some of them are very good. Some of the doctors are very thorough, and I look at these consultative exams as a representative, and I'll go, oh, okay, this one was fine. Other doctors have what I call the take up thy pallet and walk theory of rehabilitation medicine, and if you've walked into that examining room under your own power, and you can tell him what day it is, you can work. So consultative examinations can be very problematic if you get one of those doctors, but you can at least address that in the hearing process by bringing in your own medical specialists to say, this guy was wrong, he only saw me for 20 minutes. But even if it's one of the bad doctors, you still have to go to that examination and do your best. If you're found disabled and you win an initial application, yay for you. You'll receive a letter confirming that you're going to be awarded benefits. If you haven't done so already, you'll provide Social Security with direct deposit information. Nobody gets a check in the mail anymore. It is either direct deposited, and in some jurisdictions, they're now having these little debit cards, and the debit card gets loaded every month. Some of my claimants have said that's a pretty good system. Others have had all kinds of issues. And then you have the problem of what happens if your debit card gets stolen. So there's pros and cons to that debit card system. But either way, you either have to give them a checking, a savings account, or agree to go into this debit card system. Then for SSI recipients, remember, you have that means testing. You will either have a phone or in-person interview to confirm that you meet the income asset requirements. So they'll just confirm again that you've only got less than $2,000 in the bank. Excuse me. If you're denied benefits, you'll get a letter confirming your denial and the reason why you're denied. You have to appeal your denial within 60 days of the date of your letter. You'll now probably have to wait for a hearing before an administrative law judge to get a decision on your case. If you are computer literate, you can do that denial online. It's very, very easy. And here we go. You can appeal online, in person, or by phone, but SSA prefers online. It is now your responsibility to submit additional medical evidence, as I said, before the hearing. And then when the hearing is scheduled, failure to attend without really good reason may result in the denial of your claim. If you're appealing online, just make sure, or by phone, make sure that you have your decision letter in front of you, because they need the date of that denial when you're appealing online. If you do it in person or by phone with SSA, they've got that information, but still always have your denial letter with you. So now it's your job to get the medical together while you're waiting for that hearing. Okay, now, Appeals hearings is another whole session. There's all kinds of things that happen in a hearing with an administrative law judge. Obviously, not enough time to go into that. Go into that here. How to prepare for a hearing. I spend several sessions with my claimants preparing for their hearings. What's discussed in the hearing, what happens in the hearing, again, maybe something else you want for a different day. After you have your hearing, SSA will send you another letter, either favorable or you will get a second denial. If it's favorable, you'll be notified of the amount you're going to be receiving. It's called your decision. Well, first comes your decisional letter that says, yep, you've won your case and here's why, or you've lost your case and here's why. Then you will get another letter called an awards letter where you will be notified of the date when your benefits will start, any back benefit you're due, when you should get your back benefit check, and about what time of the month your monthly check should come. If you're denied again, you have 60 days to file a second appeal to the Appeals Council in Virginia. You don't have to go to Virginia, but your file goes to Virginia along with a transcript and an audio of the hearing that you just attended. So you don't have to go to Virginia, but your file does. The Appeals Council then in Virginia can do one of three things. They'll review both the transcript and the recording. They can either agree with the judge that you're not eligible, they can overturn the decision and award benefits, or remand the case back to the judge for a new hearing. So those are the three, and I got to move along because we're going to try to save the last 10 minutes for questions. Whoops, I'm sorry. I just logged I am a techno idiot, and I just logged myself out. Now I've got to log myself. Here we go. Thank you. Okay. I got to click the right button here. All right. You do have one last appeal to federal court, or you can end the case now, file a new initial application, and start the process over again. Okay. Seeking representations. Claimants can have an attorney or a non-attorney representative any time in the application process, including the initial application. All representatives are only paid if you win, and they are only paid if there's a back benefit. So if you're SSDI, you're awarded benefits, but you're in the third month of your disability is going to start at month 6, you do not have a back benefit, your attorney does not get any money for doing that. He only gets paid if there's a back benefit. SSA mandates what representatives are paid, 25% of the back benefit, not to exceed $6,000. Rarely does a case go to $6,000. Plus, we are reimbursed by the claimants for any out-of-pocket costs for such things as medical records fees. Because remember now, at the hearing, we got to go get those records, and some physicians are charging as much as $1 a page. I sometimes have hundreds of dollars in records fees. What services do representatives offer? We assist the claimants in filing all applications and appeals. We help gather the necessary records from treating sources and providers, submit pre- and post-hearing briefs to the judge, help prepare you for the hearing if necessary, and answer any of your questions through the process. Random thoughts. The disability determination process is frustrating and confusing. Don't I know it? And it's only getting worse, and it's only going to continue to get worse. SSA is denying more cases now than ever before. Most SSA, the general approval rate was about 65% of all cases. Now they're denying about 65% of all cases. I have not seen the 2014 statistics yet. Some claimants are having to apply multiple times. Changes to all aspects of the disability systems are currently being considered. This is a legislative government program, folks. Your senators and representatives are in charge of this program. They can make any changes they want to make. They can change the definition of a disability. They can decide who gets it, who doesn't. They can decide how much you're going to get. It is a legislated program. How to reach me. If you have any questions, this is my email address and my direct line phone number, and I'd be happy to talk to anybody because, again, we just raced through all of this. Okay, questions?
Janine, thank you so much for a very, very helpful presentation. We do have a lot of questions, so I'm going to jump into them right away. The first one that I'm seeing is, What happens if you do not appeal a denial within 60 days?
Then that case is dead. And any back benefits or any benefits awarded that would have been awarded you are gone. And you have to file a new case with a new start date. Now, where that gets really testy is if you're very close to no longer being SSDI eligible and being SSI eligible. It's called date last insured. So if you don't appeal, that case is dead. But if by the time you picked up your new case, you're no longer SSDI eligible, then you're an SSI eligible. So it has to be then a brand new case if you do not make that appeal date. Again, exceptions to the rule. If you were in the hospital on life support, something tragic happened, you can ask Social Security to override that, but you better have some good extenuating circumstances.
Thank you. Another question we have is what happens if you were terminated just prior to the accident and you are too injured to look for a job? Unemployment has denied you. Can you apply for SSDI?
Yes. You can apply for SSDI as soon as you are no longer working at SGA. However, you won't, if you are so badly disabled, you're awarded benefits at initial application, and it's like the 1 or 2 month thing, which does happen from time to time, your benefits just won't start for 6 months. But if you've been terminated, Social Security doesn't care. It is all about when you stopped working at SGA. So at the day you terminated becomes, and if you were working and disabled, then the date you became disabled was the date you were terminated, because that was the date you weren't working at SGA anymore.
Okay. Our next question is, many people with TBI have multiple jobs because they keep getting fired. How does that get reflected in the application?
You have a place in the application, and you get as many pages as you need to discuss that. You will identify your work history, and obviously the adjudicator is going to see all the short-term jobs. Down in the explanation section is where you will say why you've lost those jobs, and you always want to bring it back to the TBI. I couldn't cognitively function. I couldn't handle the stress. I had too many things coming at me. I couldn't process quickly enough. And that's the big one for TBI folks. They can work at some jobs, but they can't work quickly enough to work up to the speed of the non-disabled folks, so they're let go. So in that initial application, when you list those jobs, then you're going to want in the explanation section talk about why you've lost those jobs and bring it right back to the TBI. And then you'll hopefully have your medical documentation to back you up, also including your neuropsych.
Thank you. Another question we have is, if someone is eligible for both SSI and SSDI, does that mean they qualify for both Medicaid and Medicare?
Yes.
Okay.
That's the easy one. Because if you're getting SSD, yeah, you can have both.
All right.
Medicare is, to me, obviously the better program of the two. But yeah, if you get you're eligible for both.
Okay. Another question we have is a traumatic brain injury considered one of those short-term disabilities that you were talking about at the beginning of the presentation?
No. Well, again, if your brain injury and all of the medical looks towards a full recovery, you will have a more difficult time getting benefits than if your brain injury is such that you're going to have a lot of ongoing medical issues. There are a lot of folks that make a full recovery who are close to a full recovery and are functioning pretty normally, except for a few things that they have to, they work on, like their planners and things like that. Those folks will have a harder time. A TBI alone is not going to make you eligible for disability. But the severity and how that affects your ability to work in the general labor economy will have a lot to say. And again, that's why neuropsychological testing is so important to these adjudicators, because that really does highlight what folks have difficulty with.
Thank you. Another question is for dual eligibles, if you lose your SSI due to work, do you also lose your Medicaid? Or do
Yes.
you, okay. And
Well, wait, you can.
okay.
Yeah, again, the Medicare-Medicaid system is one of those things that I have trouble negotiating through, and every time it's explained to me, I get more confused. But typically, when you are no longer meeting the SSI requirements, you're no longer meeting the Medicaid requirements either.
Okay. Thank you. And so at the beginning of the presentation, you were quoting the $1,100 number. Is that for the entire household, for individual and spouse?
Individual and spouse, and then they usually do a sliding based on the number of dependents or children in the home.
Okay.
Again, that was one of those deals that it would take too long to explain how they do that.
All right. Another question is, if you have SSI and Medicaid, but then become eligible for SSDI, do you still have to wait 2 years for Medicare?
From the date of disability. Well, boy, This is why Nader has the talk list, because this is the kind of stuff that comes up all the time. I would assume the Social Security regulations state that you are Medicare eligible 2 years from the date of disability. Now, that's a very interesting question about, does that mean the date you became SSDI eligible, or is that the date you became disabled by Social Security because you became disabled under SSI? That's an excellent question. I can find that one out.
All right. Thank you. Another question we have is, what if an adult child whose parents are caring for you? Do your parents' income count as household income?
It depends. That's one of those, it depends. If you are an adult living at home with your parents, but you are paying rent and considered renting and not self-supporting, but if you're paying rent, then their income potentially doesn't count. Again, this is where that SSI means testing comes in. So that's a question I'm not sure I can answer given extenuating circumstances, because what if one of the parents is disabled themselves? That's a whole different ballgame than if you have two able-bodied parents caring for a disabled SSI person. So again, that's another one that's in those gray areas.
Okay, well, thanks for trying to answer.
Yeah, and again, I don't want to give you misinformation.
Right, and anyone can obviously contact you if they have more personal, more specific questions.
Or they can contact the toll-free number for Social Security. And I've got 1-800, you can write this down. I should have put that on the form, 1-800-772-1213. Now, here's the problem with calling Social Security. A lot of those people are new. A lot of these people and the current director of Social Security acknowledged to me that some of these people don't know what they're doing. They're brand new. They've not been well trained themselves. When I call Social Security with a question, I do best 2 out of 3. I call on a Monday or Tuesday. If I call on Tuesday or Wednesday and I get the same answer, then I'm reasonably comfortable that's a good answer. If I get 2 different answers, then I got to do best 2 out of 3. So you can call Social Security, but you have to remember that some of these people have not been thoroughly trained because they're fairly new on the job. Social Security had a huge turnover. They hired all these contract people. So just be very careful. Always call twice and ask the same question twice and see if you get the same answer.
Okay, thank you. This is going to be our last question, and it is the Medicaid income assets eligibility determined by the state level or SSA?
State level. Each state runs their Medicaid program individually. So each state is different.
Okay, well, thank you, Janine.
And for those folks who did not get their questions answered, if you want to give me a buzz or run an email by me, that'd be great.
This brings us to the end of our webinar. I want to thank Ms. Janine Holloman again for taking her time to present with us today. It has been a very thorough and very helpful presentation. If you have questions that were not addressed or you come up with one after the completion of this webinar, you can always email me at the Brain Injury Alliance. My email is jhalliday, HALLIDAY, at BIANJ.org. Or you can also email Janine, whose email I will put back on the screen right there. I want to thank all of you and have a great rest of your afternoon.
Thanks.